All right, so moving right along here, we've covered the osteology of the spine. Now we're going to talk about the back muscles. So there's three layers of the back muscles. There's the superficial layer, which is just deep to the skin. You have the intermediate layer, and then there's the deep layer, or the deep back muscles is what they're also called. So we'll start with the deep muscles, or the deep layer, okay? So what is the deep layer of back muscles? Here's the pelvis down here. They extend from the pelvis up along the length of the spine all the way to the base of the skull, okay? They're involved in movements of the spine. And the deep back muscles, their innervation is very easy to remember. They're all innervated by these dorsal primary rami of the spinal nerves. So if you remember, you have your spinal cord like this, you have your ventral root here, your dorsal root here. They come together, they form the spinal nerve. Then you have the dorsal primary rami out here and the ventral primary rami out here. This is what innervates your deep back muscles. The other function they have, if you remember, is they provide sensory innervation to the dermatomes of the skin of the back. Okay. Now, this deep layer of back muscles is divided into the deep, intermediate, and superficial layers. Okay. So there's three. Within the deep back, so there's three layers of muscles in the entire back, and then within this deep layer of muscles, there's three layers within that. Okay, so this is the deep layer of the deep muscles, the intermediate layer of the deep muscles, and then the superficial layer of the deep muscles. Just didn't want you to have any confusion. So we'll first start with the deep layer of the deep muscles. So this is three muscles that, again, run along the vertebral column, and they attach between the transverse and spinous processes of the vertebrae. So if we draw our vertebral body like this, we have our pedicles out like this, we have them come in like this to form the lamina, and then you have your spinous process out here, transverse process coming out from that junction of the pedicle and the lamina. So you have their SP. These muscles, they're very small, and they're very, very deep in the back. This is not something you're going to encounter in your superficial dissection of the back, okay? So these muscles are these, and they run all along the entire length of the spine, okay? And they're attaching between multiple transverse processes and spinous processes of multiple vertebrae, okay? Now, these three muscles, they're the Semispinalis, the multifidus, and the Rotators. So we'll go through each of those now. First off, the Semispinalis. Its origin is the transverse processes of C4 to T10. So C4 is up here, T10 is down here. So here's a 12th rib, 11th rib, 10th rib. There's T10. So if you can see, very broad origin. Insertion is C2 to T4. So C2 is up here, T4 is down in here. So we got 1, 2, 3, 4. T4. So very, as you can see, still a significantly broad. Not quite as broad as the origin, but still broad insertion. Okay? Now, the movement here is extension of the head and the spine, and then also contralateral rotation of the head. So what does that mean? That means if the left side semispinalis contracts, it can rotate the head to the right. If the right side semispinalis contracts, it rotates the head to the left. Contralateral, the opposite side. Again, the innervation, dorsal primary ramus of the spinal nerves. So if we look at the diagram here, just to show you, so you may hear it referred to as, like in this diagram shows you, as different regions. So you have capitis, cervicis, and thoracis. It's all the same muscle. As you can see, it's just kind of running along the entire length of the vertebral column, okay? So as you can see here, it's this muscle here, originating down here and moving all the way up the spine. Multifidus, this is a broad muscle. It extends from the sacrum, so down here, so sacrum would be down in here. The posterior iliac spine, so here. Transverse processes of T1 to T3, so all the way up here. And then articular processes of C4 to C7, so up here in the neck. So as you can see, it really runs pretty much the entire length of the spine. And then insertion is just spinous processes of the vertebrae. And so here it is marked in this diagram. And you can see here it's at its origin, and then it's running up here, attaching to these little knobs here, the spinous processes sticking out. Now, the major function of this muscle is just stabilization of the spine, and then the innervation, again, is dorsal primary ramus of spinal nerves. Rotators, this is a zoomed in picture here, so these are your your TPs, your transverse processes. These are your spinous processes, okay? So these are very deep muscles within the back or within the spine. They originate from your transverse processes, so here, and then they insert on the lamina and spinous processes of the immediately superior vertebrae. We'll use these muscles here, and you'll sometimes see diagrams where they're broken down in even more subtypes. The long and the short of it is, for most classes, you know, you're gonna just have to know that it's the rotators muscles, okay? And so the transverse processes, they run from, or the muscles run from the transverse process, and then you can see in this diagram here, they go just superiorly to the lamina and spinous processes of directly superior vertebrae. Now, what's their function? Stabilization of the spine. Again, they're these small muscles that kind of just help keep the spine stable. They're also thought to have a proprioception function, so helping the body know where it is in space. And then the innervation is dorsal primary ramus of spinal nerves again. So now that we've done the deep layer, let's get into the intermediate layer. This is still the deep muscles of the back, okay? So we're still deep into the back. There's still the intermediate and the superficial muscles of the back. So this is the intermediate layer of the deep muscles, okay? So this is a group of 3 muscles, and you're here they'll refer to as the erector spinae muscles, and it's the Iliocostalis, Longissimus, and Spinalis muscles. All 3 of these muscles arrive from a common tendinous origin. So for these muscles, it's easy to remember. They all 3 have the same origin. So it's down here. A lot of it's down here in the pelvis. So the sacroiliac ligament, supraspinous ligament, iliac crest, which is this bony prominence here of the pelvis, the sacrum, which is this bone down in here, and then the lumbar and thoracic vertebrae. So the first of the erector spinae muscles is the Iliocostalis, and as you can see here, again, that common origin, sacrum, iliac crest, spinous process. So, and you can see this common origin represented here by this white structure here, which is where all 3 of these muscles are originating from. And then in the case of the Iliocostalis, which is marked here, here, and here, again, this is a diagram that shows that subsections of the muscle. It's all the same muscle. You can see it extending from that common tendinous origin and inserting onto the ribs. Now, its movement. There's the unilateral movement versus the bilateral movement, okay? The unilateral movement is if just one of the muscles. So if the Iliocostalis muscle on the right contracts, it's going to flex the spine. Iliocostalis on the left contracts alone, it's going to flex the spine. If both the right and the left, if they both contract, they will extend the spine and the head. And then the innervation again, dorsal primary ramus of spinal nerves. Longissimus muscle, so let's find it here in our diagram. Again, longissimus thoracis and capitis, same muscle, they're just showing different sections of it. Here's another one, another part of it, longissimus cervicis. As you can see, it runs all along from this common tendinous origin, okay? Which is, again, the sacrum, the iliac crest, and the spinous process of lumbar and thoracic vertebrae, okay? And you can see it extending up here. Now, where does it insert? You can see it inserting onto the ribs here. Transverse processes of C10 to T12, so to give you an idea, C2 is up here, T12 is down here, so very broad insertion point, and also the mastoid process, which is a bony prominence on the inferior part of the skull. Now again, movement. Really, all 3 of these muscles have a very similar function. Unilaterally, it'll flex the spine. Bilaterally, it'll extend the spine and the head, just like Iliocostalis. And the innervation, dorsal primary ramus of spinal nerves. Then the last is the spinalis muscle. Again, it has the same origin, common tendinous origin here. And then its insertion is the spinous processes of C2 and then T1 through T8 down here. And you can see the spinalis muscle right here. You can see it making that insertion, in fact, where I've drawn. It also inserts onto the occipital bone, which is this back plate bone, posterior plate bone of the skull. Again, if you notice, all 3 of them, all 3 of these erector spinae muscles that make up this intermediate layer of the deep back muscles, they all unilaterally will flex the spine, bilaterally will extend the spine and the head, and they're all 3 innervated by dorsal primary ramus of spinal nerves. So this intermediate layer, or this erector spinae muscles, they're very easy to remember because they all have the same origin, which is this common tendinous origin. They all have the same movement, which is this unilateral, bilateral, and then they all have the same innervation. So really the major difference is the insertion. So the superficial layer of the deep back muscles. So these are two muscles on the posterior aspect of the cervical spine that move the head and the neck. And you have the Splenous Cactus muscle here, okay, and then the Splenous cervicis muscle here. And we'll go through each of those. So Splenous Cactus muscle, it has an inferior aspect of the ligamentum nuchae is part of the origin. Remember that ligamentum nuchae is shown here. It's that ligament that's in the cervical spine that's a continuation of that supraspinous ligament, so it's running along the tips of the spinous processes. It also originates from the spinous processes of C7 to T3, which would be around in this region here, okay? And then you can see this is the muscle here, and then it inserts onto the occipital bone, which is labeled here for you, which is this posterior plate bone, and then also the mastoid process, which is here, which is a bony prominence on the posterior lateral aspect of the skull. So what is it movement? It rotates the head to the ipsilateral side. So if you remember, muscles, they contract, okay? So they're going to shorten. When they contract, they shorten. When they shorten, they're pulling two objects closer together, in, you know, most cases two bones together. So what this is doing is, so it's going to contract like this. It's going to pull rotate the head to the ipsilateral side. So this is the right sided muscle. It's going to rotate the head to the right. Now the innervation, a little bit more specific, dorsal primary rami of spinal nerve C3 and C4, okay? So that's the unique one. Splenius cervicis, the origin is the spinous processes of T3 to T6. So we're talking more down in here. Down to here into the sixth. Now this, it's, if you can see here, this is cervicis right here, okay? And it inserts onto the transverse processes of C1 through C4, okay? So it originates down here, and then it inserts more medially onto these transverse processes of C1 and C4, okay? Again, it has the same movement as the Splenous Cactus, and it contracts, it moves, it rotates the head to the same side, or the ipsilateral side. And again, dorsal primary rami of lower cervical spinal nerves. And that makes sense. It's in the lower cervical region, so it's going to receive the lower cervical spinal nerves, dorsal primary rami. Now, let's get into the intermediate muscles. There's only two of them. This is now, we've exited the deep back muscles. We've done all three layers of the deep back muscles. Now we're into the intermediate back muscles. So this is two muscles that are involved in the moving the thoracic cage to assist in respiration. And they're innervated by the intercostal nerves, which are nerves that run within, just under the ribs in the thoracic cage. All right, so this is the table in your book for the two muscles, serratus posterior superior, serratus posterior inferior. Now, this diagram doesn't do a great job of showing you serratus posterior superior, because what it does, it has the rhomboid muscles here. It's just deep to these two muscles. Well, these are more superficial muscles we're going to talk about in just a second here. What it does show you well is the serratus posterior inferior. They're very similar muscles. The superior muscle has an origin in the inferior ligamentum nuchae, which is the nuchal ligament, which is this ligament that runs along the tips of the spinous processes. It also originates in the cervical and thoracic vertebrae. Okay, then it inserts onto ribs 2 through 5, so up here. Okay, and then it elevates ribs 2 through 5, so that makes sense. It's attaching to those ribs. It's going to contract. It's going to pull on those ribs. It makes sense, innervated by intercostal nerves. Then the origin of this one down here, this serratus posterior inferior, is thoracic and lumbar vertebrae. So in here, this region here, inserts onto ribs 9 through 12. So you can see that very nicely here, ribs 9 through 12. So it's inserting on those ribs. And what it makes sense, if you look at it here, it's going to contract and pull these ribs south, or inferior. It'll depress those ribs, which will also help in respiration, and it's innervated by intercostal nerves. Lastly, the superficial back muscles. These are deep to the skin, and they contribute to movement of the shoulder and upper extremity. So even though they're back muscles, they more so act on the upper extremity than moving the spine. They arise from the vertebral column, and they insert onto the bones of the shoulder. And the bones of the shoulder are the scapula, which is seen here, and then the humerus, which. So the first muscle, your trapezius, you also may have heard of it as referred to as the trap. Okay, so this is this fan-like muscle here, very broad, big muscle, and it's cut away on this side, so it'd be on both sides. And where is its origin? If you can see, it has many origination points: the skull, the ligamentum nuchae, or the nuchal ligament. Again, that's that ligament that runs along the tips of the spinous processes of the cervical spine, and then also the spinous processes of C7 through T12. So there's an error there. So it runs from C7 all the way down to T12 here. Okay, these spinous processes, and that's shown well here in this diagram. Okay. Insertion, it inserts onto the clavicle, which is your collarbone in the front, and then it attaches onto the acromion, which is a knob, a bony knob on the scapula, and then the scapular spine here. Okay, so here's the scapular spine here. The acromion is more, it's hard to show in this diagram because it's more anterior, and so it's attaching on there, and then obviously the clavicle in front. So the movement. It's got 3 fibers here, the upper fibers, middle fibers, lower fibers, big muscles. So you have your upper here. What does that do? So if you look at these fibers, they're all inserting onto the scapula. So they're going to be doing movements of the scapula. So elevating it, so pulling it up like this. Remember, muscles contract like this, pull it up. They're going to rotate the scapula during abduction of the upper extremity. So when you lift your arm away from your side. And then the middle fibers, which are in here, so these are the middle. Okay, so again, muscles contract, they shorten. It's going to retract the scapula. So what does that mean? It's kind of hard to, it'd be kind of pulling the scapula out of the page or out of the screen here. Okay, so it's almost pulling the scapula posteriorly. Okay, kind of away or kind of off of the rib cage. Then you have the lower fibers, which is down here. And these are what pull the scapula inferior. So again, muscles contract like this, pull the scapula inferior. Innervation, unique here, is the spinal accessory nerve, which is a cranial nerve 11. Now we'll go into much more detail about the cranial nerves in the head and neck chapter, but it's important to be aware of because this is a unique innervation here, that this trapezius muscle is innervated by the spinal accessory nerve. And the way you test this nerve is you place your hands on the patient's shoulders, and you ask them to shrug their shoulders against you pushing down. And if they can resist your strength pretty well, then it gives you an idea that the innervation to their trapezius is intact. Latissimus dorsi. So that's this large muscle down here in the lower back. This muscle is often a culprit in low back pain. So it originates, again, very broad muscle. The spinous processes of T6 to T12. So you have T6 here, T12 down here. It is this broad extension here. Also originates from the iliac crest, the thoracolumbar fascia, which is a thick fascial layer in this region here, and then also the lower ribs. Insertion, the interturbicular groove of the humerus. So if we draw an anterior view here of the humerus, okay, so what this muscle does is, you can see it here, it's wrapping around to the anterior surface of the humerus. So the head of the humerus would be here, okay, and we'll show you an anterior view here, so just so you have an idea of what we're talking about. Okay, so it has a greater tubercle and a lesser tubercle. So this is and then we'll draw the scapula in like this. Okay, anterior view. And then this is the lesser tubercle here. There's a groove in between here, and we'll go over this in much more detail in the shoulder and arm sections of this chapter. And so it kind of wraps around and attaches in there. And that's what helps it do its function, which is it extends, adducts, and medially rotates the upper extremity. Okay, so if you look at this muscle, it contracts, okay? So it contracts, it shortens, so it can pull the upper extremity medially like this, or it can help which is adduction. It can medially rotate or internally rotate because it's pulling on the ins from a back inside view on the upper extremity as well. And then this innervation is the thoracodorsal nerve, which is a nerve that comes off of the brachial plexus, which we'll talk about in much more detail in the next lecture about the brachial plexus and in the lecture about the shoulder. Levator scapulae. This muscle, it's easy to remember what it does because it's in the name. So here it is right here. You can see it here coming off the scapula here. It originates from the transverse processes of C1 to C4. So it dives in here behind this Splenous Cactus muscle, and then it's right coming off of here, C1 to C4. It inserts onto the medial border here of the scapula. Okay, so it inserts here. Now, again, muscles contract. They shorten, so it's going to pull the scapula superiorly. And this innervation is the dorsal scapular nerve, which is a nerve. Again, we're going to go over in much more detail in the lecture on the brachial plexus, because this is a nerve that comes right off of the C5 and C6 spinal nerve roots, which then go on to contribute to the brachial plexus. Then we have the rhomboid muscles, which are these two guys right here. So there's a rhomboid major and a rhomboid minor. Okay, so this is the major and then the minor. You have a couple groups of muscles in the body which are a major and a minor. The minor is always superior or above the major. Okay, it's always like that. There's teres major and teres minor in the shoulder region. Same thing. The minor is superior to the major, and we'll show you that in the shoulder lectures. So let's talk about the major here. Okay, it originates from the spinous processes of T2 to T5. Okay, so you can see that beautifully shown here. This is rhomboid major. And then you have rhomboid minor here, which originates from C7 to T1. And that's in this region here, so beautifully. And then they both insert onto the medial border of the scapula here. Okay, and again, minor insertion is superior to the scapula. And then the movement is, again, these muscles, they're going to contract, they're going to shorten, and then they're going to pull. And so what they do is retract or pull the scapula out of the screen and help rotate the scapula. Okay, their innervation is also that dorsal scapular nerve that's also innervating levator scapula. So if you lose that nerve, you lose innervation to 3 muscles. Lastly here, the thoracolumbar fascia. So what is that? It's a fascia in this layer here. This is a thick, deep investing fascia of the muscles of the back. It has an anterior layer that lies anterior to the erector spinae muscles, which is that intermediate layer of the deep back muscles. And then it attaches to the transverse processes of the vertebrae. It is a posterior layer, which is a more superficial layer. It lies posterior to those erector spinae muscles. It attaches to the spinous processes of the vertebrae. And then the following muscles attach to it. So Latissimus Dorsi, which is right here. You can see it attaching here. And then the abdominal wall muscles, the internal oblique and transverse abdominis muscles, which are found on the anterior portion of the abdomen, they wrap around here and have attachments also on the thoracolumbar fascia. All right, and that concludes our discussion of the back muscles.